is Maya, and I'm going to be presenting about the unresponsive medical patient. So an unresponsive medical patient is a patient or a person who cannot tell us what is wrong with them, so he's unconscious, which means that the protocols that we take are very different from the ones that we would take for a responsive patient. So I want to do that as quick, as easy as possible for you guys to understand. So we're going to go to this side. So when we start with the head. In the head, we're looking for any visible trauma, we're trying to see exactly what is wrong with him. So we have to do a head-to-toe examination, which is called the rapid physical exam. And we start with the head, like I said. So we're checking for any, injuries that we can see. So we're start palpating the face and then the back of the skull and all that, just to see what's wrong. Also, since we're going to be in the face area, we're going to check with our pen light the pupils, and that is so that we can see if the pupil constricts. I think it's constrict or dilate. One of those two. I think it's constrict. If it constricts, that means that the brain is functioning correctly. So there we would have to, then we would know that there is no brain damage that is known. Then we go to the neck. In the neck, we're going to be looking for the jugular vein. And we want to see if we can see it. And we're also going to be looking for any medical identification devices. In the chest, we're going to be looking for a good rise and fall. We want to see the presence and the same, so the equality of the breath sounds. And then for the abdomen, we're looking for distension, firmness, and rigidity. And for the pelvis, we are going to be looking if they have no voluntary control over urine or feces. So the incontinence, I think it's called incontinence. And then in the extremities, we're going to be looking for pulse. We're going to be looking for motor functions, for also any other visible injuries, sensation, oxygen saturation, medical devices too. And then for the posterior, we're going to be looking for any spinal injuries. And during the whole process, I think as I had mentioned earlier, we are going to be looking for medical devices because it can give us more intel on the patient, or, it can just tell us more about the patient in itself. Part 2. So, as I had mentioned earlier, the first step was the rapid physical examination. After we have completed that, then we can move on to obtaining the baseline vital signs. So let me look at this side again. The creaking. So, what we start with is the pulse. The pulse should be between 60 and 100. That should be the pulse rate. But since our patient is unresponsive, that kind of isn't a priority to sit there for 15 or 30 seconds to find what his pulse rate is, because he's unresponsive, which means that, we have to do this quickly. Because if he then has no pulse, we would have to start CPR. So then from there we go on to respirations, which the rate is 12 to 20 per minute. And that's just so we know, that's if he's having good breaths, he's has a good chest rise and fall. They're all the same, so he's breathing correctly and he's doing it well and it isn't forced. Then the skin. So the normal color for it to be is pink, which that means that, everything's circulating, everything's fine. So that's not a main concern. If the skin is pale and clammy, that could mean that he's going to shock. There's a lot of different things that can be known just by the skin. Also in the skin, we have to check the temperature to see, okay, if he's cold, if he's hot, because he could be losing blood too, which can make him be cold. Then, as I had said earlier, the pupils. So they must react. So we know that the brain is okay. The pupils will either constrict, or they will dilate, which will make them bigger. Dilate is when they get bigger, and constrict is when they get smaller. And then the last thing that we do is the blood pressure. The blood pressure should always be done manually because we ourselves are able to do it, and we won't have to depend on the system, on the one that does it by itself, the machine, because it isn't always correct. So the normal, or well, the average blood pressure should be less than 120. That's for systolic, and less than 80 for diastolic. And that really concludes the obtaining baseline vital signs. Personnel, so if like you would need to contact them for anything, you would have to consider. It would all be depending on all the exams that you've already done, all the assessments that you've done, and you would request if you need them. That would be mostly, you would have to contact them, and then you would have to decide where to take them for that. And then the fourth step is obtain medical history. That one is more, we just want to know the name of the patient, his age, his medical history. Did anybody see anything? Was he complaining about something before he went unconscious? Also, I think something important is that whenever you're if they are on medications, you have to really, if they have the medications on them, or if you're in a house, I think it would be good to check the labels. Correct me if I'm wrong, but I think it's good to check the labels because you can see when they got the medications, because also you could take it into an account that maybe they had a drug overdose, because that's also one of the main reasons. I think it's a really high up there. It's one of the main things that causes to be unresponsive and all that, because you had a drug overdose. Also, if you're if you have diabetes, so that was my sorry. So obtain the medical history. After you obtain all that history, then you have to talk about transport. That'd be mostly the fifth step. You have to speak about transport, where you're gonna take him. Also, handing off all the information that you've obtained at the scene to the emergency department. Also, it's the interventions and transport. So with the intervention, that's mostly you want to gather the information so that also while doing the assessment, while doing the assessment, you have to really, really check if there's any signs of spinal injury, because that will be the biggest, it's one of the most serious things, because then you have to really think about how you're going to move the patient, or how you're going to transport him, what you're going to do. So that's one of the main things, because then you have to be able to do everything that you can for that patient. And and that's the end of my presentation. Sorry I couldn't present it. I'm getting my wisdom teeth out.